Hi guys, welcome back. We shall talk about hypoglycemia today, also known as low blood sugar in simple words. So what is hypoglycemia? So if a person is having diabetes mellitus and if the value turns out to be 70 mg slash DL or less, we say it hypoglycemia. Okay, anything less than 70 mg slash DL in a diabetic patient, we say it hypoglycemia. So what is actually hypoglycemia? As you know, hypo means less, glycemia means sugar. That means there is less sugar in the bloodstreams. So why are we so concerned about hypoglycemia? So before I start off this, I would like to tell you about hypoglycemia is common in people who are having diabetes mellitus and which are currently taking insulin therapy. Yes, some people who are not diabetes mellitus, yes, they can also develop hypoglycemia. The chances are very low. In those circumstances, those people are told as spontaneous hypoglycemia. Okay, spontaneous hypoglycemia. So most likely you will be seeing a patient who is in insulin therapy. He is going to develop hypoglycemia. So why is a person who is taking insulin therapy is going to go in hypoglycemia? To understand this, we should understand what is the function of insulin. So whenever we are taking food, that food is containing carbohydrate. Now this carbohydrate will be broken down in our stomach and will be absorbed and will be released to our bloodstream. So from our bloodstreams it will go around our body. So now what is the actually thing happening is that this glucose, this blood sugar has to enter from the bloodstream to the muscle cell, primarily muscle cell. Okay, this functioning is done by the insulin. Now this insulin is released by the beta cells of the pancreas. The function of insulin, I'll repeat again, is to transfer the blood sugar which is present in the bloodstream to inside the cell. Which cell? Primarily muscle cell. Okay, so what is happening in hypoglycemia is that if a person is taking insulin therapy from outside source, let's say you are having type 1 diabetes mellitus, the primary treatment of type 1 diabetes mellitus is to give insulin shot from external source. Or if you are having a very long standing case of type 2 diabetes mellitus, you also need to take insulin in later stages of your disease progression. Okay, so what is actually happening whenever you're eating your food? Okay, your body is releasing insulin, and then again it is releasing after some time. It is releasing in two phases, in bolus phase, and then again after some time. Whenever you're eating your food, our pancreas gets activated. Okay, but the moment you're taking insulin from an external source, okay, the moment you inject to your body, you have no control. It will not see that you have eaten food or you have not eaten food. Even if you have not eaten food, the blood sugar which is present in your bloodstream, it will make sure the blood sugar to enter the muscle. Okay, in that circumstances we will go in hypoglycemia. So there has to be a normal range of blood sugar which is supposed to be present in your bloodstream. So if this blood sugar goes less than normal, you are told you are having hypoglycemia. What will happen if you're having hypoglycemia? You might go in coma, you might even have seizures, you might even die, you might have irregular heartbeats, cardiac arrhythmia. At the same time, if you're having more than normal blood sugar in your bloodstream, you will have neuropathy, nephropathy, and retinopathy. This means your retina of your eye will be damaged, your nerves will be damaged, your kidney will be damaged. You'll be more susceptible to develop infection because more amount of blood sugar in your bloodstream will act as a breathing ground. This sugar will act as a fuel for the organism to survive. At the same time, your nerves will be damaged. That means even if you get hurt somewhere, you will not feel any pain. That is the reason you have seen people who are having diabetes mellitus they are having something known as diabetic foot. That means if they're walking barefoot and they will not know that they have stepped into some stone or something, they got injured. They will not know the injury, and that injury will slowly get infected. At the same time, it will take a longer time for this injuries to get healed. Okay, that's the problem of diabetes mellitus. So our body, and I also want to tell you that the primary source of energy for a brain is glucose. Okay, it's a primary source. Okay, so our body always makes sure that we have adequate amount of glucose in our body in order to provide to our brain. So there are mainly 3 to 4 mechanisms in which our body ensures that our brain is always receiving blood glucose. So one of the most important mechanism is that whenever our body suspects and the body sees that you're going in hypoglycemia, our body will immediately stop releasing insulin, okay, from the pancreas. The second thing, our body will activate the autonomic nervous system, right? The third thing, our body will release a hormone from the pancreas. Now, this hormone is released from the alpha cells of the pancreas. This hormone is known as glucagon. Work of glucagon is to increase the blood sugar. And the fourth thing our body will do is that our body will start to release stress hormone. Now, these stress hormones are cortisol, your growth hormone. So that is the reason, if you're taking a lot amount of stress, your body will start to release cortisol. Cortisol release means more amount of blood sugar in the bloodstream. This will make development chances of diabetes mellitus. That's why please keep your stress in check. So these are the four mechanisms in our body. Our body will try to maintain the blood sugar level in order to supply to our brain. So one more thing you should remember, that if you are having type 1 diabetes mellitus, after around 5 years, your body will not be able to release glucagon. That means even if your body goes in hypoglycemic state, our body will try to compensate it by releasing glucagon. But you are diagnosed with type 1 diabetes mellitus around 5 years, after 5 years, your body will not be able to release glucagon. Even if your body goes in hypoglycemia, your body will not be able to help you. That is a very big problem for us. Okay, that's a very big problem for us. So what are the clinical features? What are the clinical features that you'll know that you're having low blood sugar and hypoglycemia? That's very, very important. Okay, so this clinical feature can be divided into two techniques. Techniques that says that you have activation of autonomic nervous system, and some reason that your brain is not receiving adequate amount of glucose. So what are the systems that you know that your autonomic nervous system is activated? Autonomic nervous system is activated. It means you'll be starting to sweat. Right, you'll be starting to sweat. You'll be having some kind of tremor. You'll be having pounding heartbeats. Okay, you'll be agitated. You'll be irritated. You'll be having anxiety. You'll be having hunger. Now, if you see about the brain is not receiving adequate amount of energy and adequate amount of carbohydrate, sugar. So, what is that you're going to see for the brain systems? You will lose the ability to coordinate. Coordination will be disturbed. Your speech will be disturbed. You will be irritated. You won't be able to focus very carefully. You will be disorientated. You won't be able to say what is the day, what is the time, is it day or night, what is your name, where are you. These things will be very tasking for you. You'll be having anger. You'll be having, you might also have delirium. So these are the symptoms that you know. Along with this, you might be having nausea, you might be having tremors, you might be having weakness, you might be having headache. So these are the symptoms that you know that you are actually going in a hypoglycemic attack. So please, whenever you take an insulin shot from an outside source, you have to eat food, because the insulin, once it is injected to your body, is not going to see that you have eaten food or not. Okay, it's not going to say you have eaten food or not. It will make sure whatever the sugar is present in the bloodstream to enter. So whenever you take an insulin shot, you have to take your food. Okay, and also please keep some sugary drinks with you. You need to have some sugary drinks always with you in order to combat this hypoglycemic state, right? So what is the treatment that you know that you are having hypoglycemia? What is the treatment? The very best treatment is to take sugary drinks, sugary substances, sugary chocolate. If you're not having anything, you can take just simple glucose solution. You mix around 10 to 15 grams of glucose, mix in water, take it. You don't have that, run down to your kitchen, take a tablespoon and take 3 to 4 heap full of tablespoon. Take table sugar, mix it in water and take it. This is the best thing you can do. Okay, sugar is the key. You don't want to go in hypoglycemia. Let me tell you, type 1 diabetes mellitus is more deadlier than type 2 diabetes mellitus. Okay. So please watch out for these clinical symptoms. And at the same time, you should understand there is something known as if you're sleeping at night and you might even have hypoglycemia. This is not nocturnal hypoglycemia. Yes, you'll be having hypoglycemia, but you will not be disturbed from your sleep, or you'll wake up from your sleep. Yes, once you wake up from your morning, you will say, I'm having headache, I'm having nightmares, I'm having seizures attack, and I'm having some kind of tremors. So this thing, the person will say, I'm irritated, I'm agitated. Okay, you are shifting your sides whenever you're sleeping. So this will say that you are most likely having a nocturnal hypoglycemia. The best way to diagnose is to check the blood sugar at night, okay, which is not always possible, okay. At the same time, you should also watch out for excessive exercises, and then also you can go in hypoglycemia. Yes, Exercises is very good. Whenever you do a lot of exercises, whenever you do any physical activity, your insulin receptor functioning there actually increases. This insulin receptor functioning actually increases. So you have taken your insulin shot and you have not eaten anything and you're doing a lot of exercises, the sensitivity of the insulin receptor will go up and most likely you'll have a hypoglycemic attack. Please, whenever you're having whenever you are having diabetes mellitus, the best exercise is to walk, is not going to the gym. You're not supposed to do any strenuous exercises. You're not supposed to do heavy weightlifting. You're not supposed to do anything that requires you to have a maneuver, that's a Valsalva maneuver. You're not supposed to do that, because most of the people who are having diabetes mellitus later or then that time only, they might be having some issue with your heart. So anything which is requiring you to put a lot of pressure, isometric exercises, eccentric phases of exercises, or you are doing a lot of push exercises, your blood pressure rises. You might actually put extra load on your heart, or you might even rupture your blood vessels. So this is never advised, okay? And you should always wear a badge, okay? This badge says I'm diabetic, type 1 diabetic. This is very, very important. If you're walking somewhere, you are in a hall, you're in a movie theater, or you suddenly you lost your consciousness, you have a hypoglycemic attack and you lost your consciousness, people around you might not be able to identify the clinical features. But if you have this badge, it's very, very necessary that people will be able to identify that, and at the same time they will be able to give you some sugary drinks. And please keep the sugary drinks with you all the time, okay? So that was about hypoglycemia. Yes, it is common in people who are taking insulin therapy and in type 2 diabetes mellitus. Yes, because in long-standing type 2 diabetes mellitus, we are also giving you insulin therapy, okay? And yes, chances are very low that a person is not having diabetes mellitus and he will be having hypoglycemia. Chances are low. But the whole summary about this video is that you should be able to identify the clinical features. You'll be having, again, clinical feature, I want to emphasize it about it again. You'll be having tremor, you'll be having headache, you'll be having agitated, you'll be having sweating, you'll be having pounding heartbeat, you'll be not able to concentrate, you'll be having delirium, you'll be having altered sensorium, you'll be having anger, you'll be hungry, okay, you'll be having twitching on your face, you'll be having trembling sensation. This will say that you are having hypoglycemic attack. Once you know you are having hypoglycemic attack, immediately go and take an sugary drink. And please, whenever you take your insulin shot from an outside source, you are always supposed to take your food, because our body is very smart, but the insulin that has been taken from an outside source is not smart. It's not going to see that you have taken your food or not. You put it inside and it will work. If you're not eating food, our body will not release insulin, okay? That is, our body is very smart. And the bad thing about this also is that if you are having type 1 diabetes mellitus, around 5 years later, your glucagon release or secretion or functioning will not be effective. Even if you are going in hypoglycemic attack, your body will try to compensate it by releasing glucagon, but your glucagon will not be working. Okay, you might not be able to release your glucagon. That's the very big problem about type 1 diabetes mellitus. So please wear the badge and try to identify the clinical symptoms and the treatment. This treatment is very, very necessary that you know the treatment. It's very simple. Take any sugary drink or take just normal table sugar, 3 to 4 tablespoon, heaps full of tablespoon of table sugar, mix it with water, just take it. Wear the badge and know the clinical features. And also, whenever you're having diabetes mellitus, please go and meet your doctor on a regular interval. At least once a year, you have to go and meet your ophthalmologist. He needs to check your eye. There is something called diabetic retinopathy. Your retina is generally been damaged. You should always check for your sole of your foot. Your nerves have been damaged. So this is very, very important that you actually watch out for this diabetes mellitus. And type 1 diabetes mellitus is more dangerous as compared to type 2 diabetes mellitus. Please watch out for the symptoms of hypoglycemia, and remember the symptoms and remember the treatment, sugar. That's all for now. Thank you, and see you around.